Okay, let's start. Welcome everyone. Yeah, as I already requested, as you join in, would love to invite you to activate your cameras if your connectivity allows, and would like to see everyone's faces and know each other better. So here is some practical guidance for our French speakers. We are providing interpretation for the meeting. So if you would like to hear French, please click on the interpretation globe at the bottom of your screen and select French. If you have any questions in French, you can send a chat message to my colleague, Suzanne, who will be able to help you. Again, welcome everyone, and thank you for taking the time today for this second collaborative session on community engagement. My name is Govinda Prasad, and I'm the Senior Technical Advisor for Social Cohesion and Social Accountability for IDEAL. Would like to remind you that the community engagement is a broader topic, and it's been experienced and implemented in various contexts, as we all know, and we are using various approaches and processes. So this platform will be a space for us to reflect on collective practices and also learn from each other. As a reminder of first session, I believe many of you participated on that. We organized that on last September. We heard from the community, the community visioning experience from Zimbabwe RIPSA, Amali Maloko and Takunda, and we collectively reflected on our own community mobilization approach and the context. And also we identified common challenges and also gathered the different topics for the further discussion. Here are the topics of interest that came up. So how to use technology in community engagement, how does culture and religion affects community engagement process, how to engage with government, especially like government buy-in, and how to motivate and build this trust of the community in the community engagement process. And the collection and sharing of community engagement tools and the processes used by various implementing partners. So for today's session, one of the key topics that will be discussed is government engagement. Today's session will focus on employing community engagement as an accountability mechanism to improve service delivery. We have organized today's session in two sections. As you can see on the screen, we'll start with this session with a presentation from Huayo from the BHK, and followed by the sharing from Nobodyatra RIPSA in Bangladesh. And then we have the second part where we'll divide into small groups to share our experiences and processes in this topic. So without making any delay, I'll now pass it over to Hua. Hua, over to you.
Thank you, Govinda. Good morning, good afternoon, good evening to everyone. Thank you so much for joining us. Just really glad to have you today to hear from our colleagues in Bangladesh on their experience on social accountability. Before we start, just a very quick, reflection on why we talk about social accountability in RIFSAs. So let's do that real quick, and that will give us a good framing to start with. Next slide, please. So no doubt that many of you have seen many of these phrases floating around: citizen advisory boards, scorecards, action plans, report cards, expenditure tracking. But really, although there are multiple definitions of social accountability, I put the one from the World Bank here, which is social accountability mechanisms refer to a broad range of actions beyond voting that citizens, communities, and civil society organizations can use to hold government officials, bureaucrats, and other duty bearers accountable. So what does that mean? I mean, what does that look like? We'll hear a lot about that today from our Nobodyatra colleagues, but let's take a look at something we call the governance triangle. So next slide, please. Many of you are familiar with the governance triangle, and if you had a moment to view the 10-minute video that was sent out with the invitation, you're already familiar with this. But you see that there are citizens and their communities, their government, as well as service providers. If you look between the two purple squares, very often what will happen is that government or public sector workers of some sort are responsible for providing basic services such as in healthcare, education, or public safety, such as firefighting. Other times, they will work and to engage or contract service providers in the private sector or with organizations to provide services. Again, similar services in some ways, maybe the building and maintenance of roads. A lot of countries, their mail services are privatized, some are public. Cell phone services, again, it depends on where you live. But often a lot of that service and infrastructure is maintained by the private sector. So a lot of the countries that we live in really uses a mix of both pathways to provide services to their citizens. Next slide, please. Social accountability really focuses on the capacities of citizens and communities to engage and build a relationship with their government and with the service providers. So really holding accountable both the government for the direct services they provide, but also holding service providers and the government accountable for the services that are provided through the other actors. If you look under the boxes, those are some of the terms we often use in this triangle. For communities, they might sometimes be referred to as clients, customers, service users, and often the civil society organizations are also part of those communities as well and take on the role of doing that advocacy and accountability role on behalf of communities. Service providers include the private sector, other organizations, they are also duty bearers, and then the government as well, which includes national government, local government. They are duty bearers for different kinds and levels of services. Next slide, please. So for many of you who do work on RIFSAs, RIFSA designs are directly influenced by a 10-year food security and food assistance strategy from the Legacy Office for Food for Peace. And in addition to the strategic objectives around livelihoods, as well as transforming the environment in which the households live, we have 3 cross-cutting intermediate results, 1 on gender and youth, 1 on social cohesion, and 1 on social accountability. And you see that in the yellow box under cross-cutting IR3, that social accountability is one of the cross-cutting intermediate results for all RIFSAs. And that's why you do see a lot of this come up. But really, there's a greater reason than the fact that it's in a policy document or a strategy document. And that greater reason is sustainability. Next slide, please. So when we look back at the governance triangle, many of us who are on the implementing partner side are really part of that blue box. And because the government either has requirements for assistance, deficits and functionality, or budget shortfalls, or many various reasons, often partners do come and play that role of service providers. And you see that with our RIFSAs in terms of us going side by side to help with either WASH, nutrition, health, food security, agriculture services of various kinds, and other sectoral services. this is really something where if you think with the end in mind, one of the things that we have to keep an eye on is to not become a permanent substitute or parallel service provider. And that's why we really have to think about various ways of doing sustainability, keeping this triangle in mind. As simple and basic as this visual is, might be helpful in terms of planning and implementing various projects, including RIPSAS. So today we're going to hear about how a project has really been able to use social accountability to take themselves out of this blue square longer term, and really kind of build the capacity of the citizen and community squares to engage with the government in terms of services. So let's go right to that, because I know you will be very curious about how they're able to do this. And let me pass it on to Alex to talk about social accountability in Nobodyatra.
Yeah, thank you so much for yeah, thank you so much. Wow, this is Alex. Yeah, so I think that's a really very good introduction into social accountability and how within Nobodyatra we have actually applied it. So next slide, please. Yeah, so Nobodyatra is again a USAID-funded food security resilience activity that's implemented in Southwest Bangladesh. And started off as a 5-year program, but then again reflecting on sustainability as well as strengthening systems, and effectively leading to handing over services to key critical system actors within operational areas. It was extended for another 2 years, so we're in our last year of implementation. Overall, the project is reaching out almost 850,000 direct project participants. And it's $86.8 million. Next slide, please. Yeah, as already indicated, it's a multi-sector integrated program. As you can see, those are the different components working in, from maternal child health, nutrition, water, sanitation, and hygiene, gender as a cross-cutting theme, as well as youth. We've got also aspects of disaster risk reduction. Being in the Southwest, we are at the ground zero of climate change. Every year we have, cyclones and floodings. Then there is the aspect of agriculture and alternative livelihoods, where we use the systems lens to, ensure that, private sector plays a critical role there. And then finally, what we're going to discuss today is on good governance, social accountability, where effectively we're working with the different stakeholders to ensure that all these different services that, as already mentioned, are actually sustained within the respective communities we operate from. Next slide, please. Yeah, so what's the country context in Bangladesh? Bangladesh, it's, the decision-making effectively, is really very much centralized. So, at the community level, they have to really, you've got what they call the union parishad, who has to report to somebody at the, you've got the union as a structure, you've got the union, you've got the ward, which is the lowest denominator in terms of like the governance structures. Then after that, you've got the union. Then you have the upazila, and then after that you've got the district, and from the district you've got the division, and then from the division you've got the central government. So you can see there's a lot of bureaucracy, and decision making really takes a long time to. It has to come all the way. It's a top-down sort of like structure, and at the same time also the budgeting process is also centralized. So it all comes all the way from the DACA all the way to the community level, and therefore sometimes the allocation can be a bit difficult. And then also the other thing we observe is that the capacities of the the local governance structures within the communities are also limited. There's a lot of work that needs to be done from prioritizing resources to actually understanding what their roles and responsibilities are. As already indicated, the project is, in a remote location, Southwest Bangladesh. It's disaster prone, and it's contextualized with a high prevalence of social cultural norms that actually influence the social behaviors within the communities we operate from. Next slide, please. Yeah, so the Nobodyatra social accountability approach is based on already a framework that has already been reflected on, which is which is also applied by USAID, social accountability principles. And this reflects on number one, getting the community to be able to participate, in decision making. There's inclusivity, making sure that women, boys and girls, as well as they're able to get their voices heard at in terms like when there's allocation of resources or demand for service improvement. Then there's also transparency as well, which is basically looking at conducting community awareness sessions where through that where community leaders are actually held accountable, and communities can actually reflect on their grievances, at the same time also demand for service improvement depending on their priorities. And through this framework, we see that the communities are empowered to continue to demand for improved service delivery, but at the same time also there is also a sense of ownership from the different stakeholders in this case. And the way the project is implementing this is through working with, facilitating the citizen voice action to improve service delivery, and also working with the different governance structures. So here you've got, for example, aspects of participatory planning on budgeting. You've got also the union opposila, which is basically a governance structure, where you've got at the community level different structures that are aimed at improving, holding the elected officials as well as the civil servants accountable. Next slide, please. Yeah, this is a quick reflection on some of the, overview of some of the results. So since this approach was implemented, and my colleague Nimro will kind of like go into the details around, how it's applied, we have seen that actually, there's been an increased allocation for the wash sector, for example, and we can see that there was 52.5%. The Union Parish, in this case, got more investments in water. And so I have to say that in the Southwest, one of the key critical shocks that or stresses that people actually experience here is the water. There is a high level of saline intrusion into water systems. So communities' demand for increased community demand for access to improved water sources is really very high. At the same time, also due to that salinity, we see also aspects of health facilities that are actually impacted, and we have seen actually also there's been a 60% increase also in budget allocation for health services from more equipment being supplied at the community health clinics to more community workers being actually being stationed within these community clinics. Further to that, also we see that service standards have also increased. So for example, from agriculture, we've got farmer field schools, as well as the Department of Agricultural Service Extension Services, as well as the collection point markets, where they're actually advocating for things to do with, for example, we had an issue of army fallworm during the last couple of years, and through this approach, there was actually demand where the farmers were able to see that there was services, or there was a technical support provided to kind of like mitigate this impact within agricultural activities. Next slide, please. Yeah, so an overview of the citizen voice action, as already indicated, my colleague Nima will be talking more of this, but effectively it's a local level advocacy and social accountability approach that facilitates dialogue between communities and government in order to improve services. And its primary objective is to increase dialogue and accountability between the different service providers, in this case, or three groups, should I say, in this case, citizens, as well as the public service providers and government officials. Yeah, and that's kind of like a framework of it there, which is basically looking at, there is access to information. The citizens are actually also, speaking out, and then that brings about, dialogue between, in this case, the government officials as well as, the community, which leads to improved accountability. Next slide, please. I'll hand it over to my colleague Nimrol for to take us through the actual approach itself. Thank you so much.
Thank you, Alex, for briefly sharing the project as well as result overview of social accountability initiatives in Nobodyatra projects. Once again, good morning, good afternoon, and good evening to all the participants from different parts of globe. Nobodyatra project uses World Vision's most effective local level advocacy and social accountability approach called Citizen Voice and Action. I will share a bit about the process, results, and learning of the process. As Alex was indicating, CBA approach is really a unique approach to empower community people in a systematic way with providing necessary information and skills to raise collective voice, as well as to negotiate with service providers and decision makers for service improvement. This diagram is showing the overview of CBA process. And I would try to explain a bit, not in details, that how the process effectively engages community to improve services, as well as to address any development challenges in their locality. Broadly, the approach has 3 phases, and you are observing it. The first phase that we called enabling citizen engagement. This community in this phase, the community learn their entitlements as per government policy and build relationship and network among different stakeholders. In this phase, the community people get opportunity to organize themselves and build their skills that gives them confidence to negotiate with service providers and decision makers. The second phase that we called engagement via community gathering, where the community people work collaboratively with service providers and government decision makers to find the status of services, and at the end develop an action plan to improve the services. This phase is really the heart of the CBA processes. Here in the scorecard session, the community people rate the services using the mode meter. After that, the community people, service providers of the service centers, and decision makers come together, discuss about the findings of monitoring standard sessions and community scorecard, and based on this develop an action plan to improve the services. In the second phase, that is really an important phase for community engagement. And finally, improving services and influencing policy. And in this phase, the community work with different stakeholders to implement the action plan that has been developed during the phase 2, especially on the step that we call interface meeting. And they also try to influence decision makers through dialogues at sub-district level, divisional level, even at national level to improve the services. Considering the project goal, the project prioritize health, wash, and agriculture sector and directly work with community clinics, union health and family welfare centers, union artisan committees, and union agriculture service unit to achieve the goal and also sustaining the project outcomes. We are observing a number of immediate results in different sectors, as Alex was highlighting some overview of the results. In next slide, I will highlight few of those results. So next slide. This slide is showing the comparison of monitoring standard for community clinics. At the very beginning of CBA process with community clinic, the project, along with other stakeholders, identified 22 monitoring standards for community clinic, considering the infrastructural facility, availability of service providers, service day, and duration. In the graph, the black bar is indicating the percentage of community clinic. Okay. In the graph, in the black bar is indicating the percentage of community clinic complying monitoring standards at the initial stage of CBA processes back in 2017. Whereas the yellow bar is indicating the percentage of community clinic complying monitoring standards after CBA processes that we collect the information in 2019. So from the graph, it has been identified that the compliance of monitoring standards in community clinics has increased. We found around 88% of the community clinics met more than 75% of the monitoring standards in 2019. That was only 49% back in 2017. For example, there are few examples. I will only go for one. That is, 42% of community clinics have improved drinking water sources. That was only 22% before the CBA processes. Next slide, please. So as Alex was highlighting the trickle of effects of the citizen voice and action process, Bangladesh government has already incorporated Nobodyatra projects working areas under the multi-purpose health volunteering program after a national dialogue regarding community clinic. And government has already deployed about 932 multi-purpose health volunteers in 4 sub-districts to continue the primary health and nutrition services. In this picture, we are observing one of the multi-purpose health volunteers, Sharifa Khatun, who is actually providing services, measuring the mock at one of the EPI sites. In next slides, we will see few quotes from service receiver and providers, as well as the local government representatives, how the approach helps to improve the services and how those approaches motivate them to render effective services to the service seekers. So in here, you are seeing Hosnera Begum, a young mother visiting Khona Khatail Community Clinic. And she stated the changes in community clinics due to the CBA process, especially the attitude of service provider that encourage them to seek the services from the community clinics. Next slide, please. So in this slide, here we are observing one of the service provider of community clinic, whose name is Pradipto Sarkar, and he said that a community, the CBA processes changes many aspects of the community clinic. Mainly, he emphasized on the feedback mechanism of local communities, and he said that the feedback of local communities has increased, and that is making them more responsive and accountable to provide their services. So that's also related with the motivation why they are providing improved services. In next slides, I will also highlight a few of the motivating factors why the service providers and local government representatives are more active and more engaging to provide improved services. Next slide, please. CBA process also influence local government institutions to allocate resource effectively considering the community demand. Here we are observing a quote from Said Mehdi, who is the Upazila chairman of Kaligans, one of our working area. Earlier, he was the chairman of Moutola Union Parishad. And he stated that CBA processes minimize the coordination gap among different departments and local government institutions. And that's why when they informed about the real status of any service centers, then they are providing and they are increasing their budget allocations from their institutions. Next slide, please. So in this slide, we are also observing the improvement of monitoring standards for Union Orson committees and Union Agriculture Service Unit. For example, 83% of Union Orson committees are now having their GEO-NGO coordination meeting. That was only 58% earlier. And we are also witnessed that the sub-assistant agriculture officers are working more collaborated way with Union Parishad and sitting in Union Parishad to provide necessary technical information and advice to the most vulnerable farmers. Union Parishad are also supporting them to make their sitting room more workable. So this collective action also influencing the service environment. In next slide, I will try to show a few factors that triggered by the CBA processes to improve the services. Next slide, please. The above course as well as the field evidence reveals different factors that trigger the service providers and local government representatives to be more responsive to play their roles. And here are a few factors. For example, collective demand of community, self-realizations during the CBA process, especially in monitoring a standard session and interface meeting, that strike the realization within the service providers and local government representatives. Positive image in the community and respective service department. Due to the process, the monitoring and follow-up from the supervisors levels have increased, which also trigger the service providers to provide improved services. And finally, the collective action of community, local allies, and elected representative improved the service providing environment, such as repairing of community clinic buildings, furniture for union agriculture service unit, as well as electrification, water tank, medical equipments, and toilet facilities that also triggered their motivation for services. In next slide, I would highlight few lessons that we have learned throughout the journey of CBA process in Nobodyatra project. So throughout the years of implementation, the project experienced different learnings regarding community engagement. And among those, here are few. And if I consider the first one, the flow of information among the community people and local government institutions are crucial to empower and engage community in different decision-making processes. And also the CBA process make an environment to create a platform where the service provider, service receivers, and decision makers can come together and dialogue with each other. And it has learned that dialogue among the service providers and community people minimize understanding gaps that helps to improve the services through collective actions. And finally, the continuous flow of action, continuous follow-up of action plan is necessary for service improvement. Next slide, please. So, yeah, Nobodyatra project had an evaluation on CBA processes. And here is the link where you will get the details report of the CBA evaluation. So I would request you all to navigate through the link to get more about the process and how it contributed to improve the services by community engagement in our working area. So you will get all the details if you navigate through this link. Next slide. So thank you, and that's all from my side. Thank you very much for your patience and hearing us. Thank you, and over to Govinda.
Thank you. Thank you so much, Nobodyatra team and Hua, for the great presentation. As we planned for the breakout session, before opening up the discussion to all participants in the small groups, we'd like to give the opportunity for anyone to ask the questions to Nobodyatra team members on their presentation. We'll just take the next 5 minutes, so feel free to either write your questions in the chat or activate your microphone and speak out. Yeah, you can either use the chat box to put up your questions, or you can speak out. Is there any? Okay. Any questions to Nobodyatra team? Maybe as we wait for other colleagues to come up with the questions or the reaction, I can I can start. So it was really great to see your presentation and the whole flow of this CBA approach. So I was wondering generally how much time does it take to complete the full cycle of this CBA approach, or it's the it happens in this small bit and piece, or it's the full cycle that should be done in order to get that into that results that you shared recently.
Thank you, Govinda, for raising these questions, and it's a nice questions. So if you want to implement the total CBA processes, or if you want to fulfill on cycle, it will take more than 1.5 years. For example, you saw that there are 3 phases in the CBA process. For first phases that we call enabling citizen engagement, it will take around 6 to 12 months because we need to identify the government policy standards, as well as we need to build the capacity of the community people so that they can engage and they can negotiate with the service provider as well as the decision makers. So this phase will take more time. And if you consider the second phase that we called engagement via community gathering, it will take 1 week to 1 month because there are 4 different steps we have to complete it. For second phase, there are 4 steps, and we can complete all the 4 steps within a month. And for third phase that we call improving services and influencing policy, that is really depend. It may be shorter term because there are some action plan that needs more time. There are some action points that need medium period of time. There are some action points that need long time. And you know that influencing the policy is really take long time. So it is tough to bound the timeline for third phase, that is the influencing policy. But for first phase and second phase, it will take that is 13 to 15 months. But the last phase, it depends on the situation, also the government stakeholders.
Great, thank you, Nirmal. I hope it's helpful for the other colleagues as well. So I can see one question from the Jalalim, if I pronounce it correctly. So the question is, citizen voice and action, CBA, is social accountability tool or not?
Yeah, absolutely. As Alex was also saying, and I was also mentioning that citizen voice and action is an local level advocacy and social accountability tools or approach. How we can engage community people and we can ensure the community engagement in different government processes to ensure the accountability. So it's a tool, we can call it.
Great, thank you. So yeah, we have almost use the 5 minutes of time for the Q&A. If you want to follow the more information about the Nobodyatra and also the citizen voice and action, you can follow the link that's been provided in the chat and also in the presentation. And Nobodyatra team is here with us throughout this session, so you can talk to colleagues and get the response. So I can see the hand raised. I think it's from who are you? Yeah, please, over to you.
Hi, thanks. I have a question about one of the slides. If you go back, Suzanne, I think there's a slide on service providers. There there we go. Major motivational factors. So I find this slide interesting because I think a lot of people who work on RIFSAs and other programs have questions about incentivization of their local government counterparts. My question to the Nobodyatra team is there a particular priority or an emphasis that you think makes a bigger difference in incentivizing our local government colleagues? What do you think some breakthrough factors are?
Thank you for the questions. Yes, it is really important, and as indicated in the third point, that when it's come to local government bodies or local elected representatives, they want to create a positive image to their community people. And when the community people have the same issues or same community problems in their community. For example, in our working area, we found that when the community people identified that in community clinics, there are some issues that need to solve to provide the health services to the community people. And when these issues came up during the interface meeting, where the local government representative were present, and they identified that this is the community need. During this dialogue session, they said, or they agreed to assure the community people that the local government will take some sorts of initiative to address some of the gaps. And when they announced in a bigger form, where almost 100 community people are there, that also triggered them to address the gaps so that the community have a positive impression regarding the local government representative.
And that's actually, just to add on that as well, I think in other contexts, I think as practitioners, you can kind of like map out, stakeholders within that particular community to kind of like gauge the kind of like the power dynamics. And in this case, I'll give you an example. For example, in Bangladesh, the kind of like the most senior civil servant at the union parishad is, these are people who are really starting off their careers in the civil service. And they will tend to really, they want to really do very well, and so they can be promoted. So you leverage on something like that because you know that, and you engage them, and have them actually participate in some of these activities at the community level. And then at the same time, you look at elected leaders. So those are the same people also, because they realize that actually they're also there is that opportunity for them to be able to be held accountable when it comes to election times. So you engage them, and you kind of like link to how the opportunity to actually increase or improve service delivery can also improve their opportunity to be able to be good representatives as well. And then the other thing that you can also reflect on is the local elite as well. There are community leaders, faith leaders, for example, they can be part of that. And you see, when you look at, for example, you've got the water management structures, you've got the water and sanitation committees, and then you've got them actually now demanding for improved service delivery from the elected officials as well as the civil servants. So that's something that you can kind of like use. And by doing that, one of the best ways is by basically mapping out those different stakeholders and their different power dynamics. Yeah, thank you.
Good, thank you. Thank you for your response and the great questions. I can see the questions coming up in the chat. So I think we can take these questions later on as we are running out of time as planned. So there is one question to Nobodyatra team. How does 90% union works and committees committees union made the above 50% standards? What are the criteria used to evaluate them? Maybe you can respond it on the chat. so that we can save a little bit of time. Yeah, so yeah, we without making any delay, let's move on to our next section of this event. So I'd like to thank Nobodyatra team and Hua for the sharing the presentation and sharing the experience. And now we'll go into this small breakout session, and it will be about 20 minutes to reflect